Let's open this lesson with a question. If you're born in the US, are you likely to have a longer or shorter lifespan than if you are born in another industrialized country? It's an interesting question, isn't it? Ever brought it up to your friends? Discussing healthcare among friends can get a little sticky sometimes. Everyone seems to have his or her own opinion of what works and what doesn't when it comes to what approach works best in taking care of the health needs of the residents of a given country. The questions that often come up are things like, what is a healthcare system anyway? What's the difference between universal healthcare and whatever the US has? And which approach to healthcare has the best health outcomes? Let's look at each of these. The World Health Organization, or WHO, an agency of the UN, or United Nations, focuses on international health. WHO has defined a health system, also called a healthcare delivery system, as all the activities to promote, restore, or maintain health. This broad definition includes policies, regulations, laws, and both direct and indirect patient care. In the United States, healthcare delivery grew from a local family doctor to larger group practices. Often a family member could be taught to follow the doctor's orders and no outside help was needed. The family paid the doctor however they could, and bartering was common. Hospitals came on the scene to make it easier for doctors to see their patients in one place and for nurses to care for more patients at once. People who had money and could pay for the services of doctors and nurses received health care. Those without money or resources to pay simply managed to get by without professional health care. That approach to paying for health care changed when Medicare, Medicaid, and employer-paid health insurance arrived on the scene. However, that still left about 15% of Americans who were uncovered and could not afford private health insurance. The Affordable Care Act, also known as the ACA, was a step in trying to close that gap, and to some degree it did. People who had no health insurance coverage prior to ACA could buy health insurance through the insurance marketplace. Depending on their income, they might be able to get help paying for the insurance. Many people chose plans with lower monthly costs so it would be more affordable. Unfortunately, the lower-cost plans came with higher deductible and higher copays. When the person needed to use his newly acquired health insurance, he was faced with deductibles of $5,000 or more that had to be met before the insurance would pay. And that was in addition to the copays. In practical terms, these individuals still were not covered unless there was a medical emergency. With a continued lack of coverage for everyone, how does that compare to universal healthcare programs in other countries? First, let's define universal healthcare. Most industrialized countries, other than the United States, provide a system of universal healthcare coverage for its residents. Universal health coverage, commonly known as universal healthcare or UHC, is defined by WHO as a method to ensure that all people obtain the health services they need without suffering financial hardship when paying for them. According to WHO, healthcare systems' goals are good health for the citizens, responsiveness to the expectations of the population, and fair means of funding operations. Let's look at the first and third goals and see how the U.S. measures up to other industrialized countries. According to statistics gathered by WHO, there are two countries that spend more money per person for healthcare than the U.S. at $9,146. They're Norway at $9,715 and Switzerland at $9,276. All other countries spend less and have a larger percentage of their population covered, resulting in better overall health outcomes. So, if they spend less, how do they pay for it? There are several ways to fund the cost of UHC. Tax-paid national systems, tax paid with user fees, often at point of use, health insurance systems paid by governments, citizens, or some mixture, and decentralized private systems run for profit or not for profit. Every country funds healthcare in its own way. Generally, poorer nations struggle to provide adequate health care. Consequently, which care that is offered by UHC varies from country to country. Some countries include all healthcare services, including preventative care. Others exclude certain services. For example, Japan excludes normal births. But do they really have better health outcomes? The WHO gathers data from the UN regarding specific measures of health. While wealthy Americans and those with good insurance may have access to the best healthcare in the world, there is distinct differences in access to care. Low-income and even middle-income families risk bankruptcy if there's just one medical emergency. Because of this vast difference, American healthcare doesn't compare all that well with other countries who offer UHC to their citizens. The chart on your screen shows a sample of the healthcare outcomes data collected by WHO. As you can see, 17.1% of the United States gross domestic product, that's GDP in the chart, is devoted to healthcare costs, while still boasting the highest obesity rate and the lowest life expectancy, highest maternal mortality rate, and highest neonatal mortality rate of the countries surveyed here. So in the end, it looks like being born in the US would mean a shorter life, a higher risk of dying in childbirth or before the age of 28 days, and a higher likelihood of being obese than any other country on the list. Let's review what we've learned. A healthcare delivery system is defined by the World Health Organization, which tracks worldwide health outcomes data, as a system that includes doing what it takes to promote, restore, or maintain health. United States healthcare has a great disparity in access due to financial or geographical barriers. Many other countries in the world offer universal healthcare, or UHC, which the WHO defines as a system designed to provide a country's residents with care when it's warranted and have better health statistics with lower costs and less financial burden on the individual. This kind of system is usually funded by a combination of public and private insurance funds and by the individual at point of service.